Hello, everyone, and thanks for attending the Pinnacle Quality Insight CAHPS Q&A session, Lunch with Angell. Today, we are pleased to have Angell Hansen, Account Manager at Pinnacle Quality Insight, who will be answering questions. My name is Kimberly Sondrager. I'm the Marketing Manager. Before we begin, let's start with some housekeeping items. First, I would like to direct your attention to the control panel on your screen if you are joining us online. At the top of the control panel, you will notice an orange arrow that points left. When you click on this button, the control panel will open. Here you will see audio options and a question section. You can hear our webinar today either through your computer's audio or on your telephone. A dial-in telephone number is listed here. This is a broadcast-only webinar, so the audience is muted. However, we invite you to share comments and questions by messaging us through the control panel. Below the audio options section is the questions section. If you have questions for Angell that you have not sent her prior to the Q&A session, please type your questions here and press send. When you exit the Q&A session, you will receive a short survey. We invite you to take a moment to participate in the survey so we can continue improving. After the webinar is done, we will email you a recording of the Q&A session and a link to the handout. All right, with the housekeeping items out of the way, I'm pleased to turn the time over to Angell.
Hello, welcome to our third edition of Lunch with Angell. Remember, my main goal for these sessions is to give you an opportunity to reach out with your questions, give us feedback on the CAHPS surveys, tell us what's working for you and what's not, and to help you make the best of the CAHPS process. We understand that the CAHPS survey is only one important part in your agency's quality improvement system. If this piece can work well and to your benefit, then your quality will improve too. Now, just to clarify, if you're on this call, you're a current Pinnacle Quality Insight client who has the product Home Health CAHPS surveys, Hospice CAHPS surveys, or both. This discussion will be focused on these surveys. And today we are addressing the topic of comment alerts. Many questions that I answer can be found on the official CAHPS websites. If you have not looked at them in a month or so, do so now. It's good to check this website at least twice a month for any new announcements concerning the CAHPS surveys and to stay up to date. For home health, go to homehhealthcahps.org, and for hospice, go to hospicecahpssurvey.org. It's time to check the quarterly refresh on the Home Health Compare, and looking ahead, the Hospice Compare refresh will be in August. This month, you should be checking Casper to preview your data now. Time for a quick poll. I'm going to give you a couple minutes to answer this question. How long have you used Pinnacle Quality Insight for CAHPS surveys? Answer A, 6 months or less, B, 7 months to 1 year, C, 1 year or more, D, since the beginning of CAHPS. While responses are being gathered, I'd like to share some information that was mentioned during the last Open Door forum hosted by CMS on Tuesday, July 9th. Information about Home Health CAHPS announced a new measure on Home Health Compare beginning October 2019. It's coming up soon. This new measure is called Potentially Preventable Readmissions, or PPR. PPR estimates the rate of unplanned potentially preventable readmissions for patients following discharge from a home health agency. PPR is a risk-adjusted outcome measure. This measure does not affect the CAHPS survey. For more information about this measure, you can visit the Home Health Quality Measure page of the HHQRP website, and I'll show you that website here in a moment. Now for the hospice information announced during the Open Door forum. There is a freeze date of August 15th for the next Hospice Compare refresh. This is something new that's been happening this year as a freeze date. It means that by August 15th, hospice providers should submit their hospice item set or HIS modification and then activation records for changes to be reflected in the next Hospice Compare refresh. Looks like poll results are in.
They sure are, and it looks like we have 33% said 1 year and 67% said since the beginning of CAHPS.
It sounds like we have some loyal followers today. I appreciate you all for joining us. So here is the website to go to that I was referencing, the CMS Open Door Forms. They happen roughly quarterly, and the time that they are announced, you'll need to keep on track of this website, or you can sign up for their mailing list. So to find this website, instead of writing down that really long URL, you can do a web search for CMS Open Door Forms. I tested it on a couple of browsers. It should get you to the cms.gov page that we're looking at here, called Home Health, Hospice, and Durable Medical Equipment Open Door Form. And all of these will be addressed during these calls. The great thing about these is that you're getting the most recent up-to-date information for your home health or hospice agency. Once you're at this website, they have a section, if you look on the left-hand menu, called Related Links. You can click on the link and sign up for the mailing list, and they even post previously recorded sessions. If you're not able to attend that specific day, they'll do a recording and transcript, and so you'll find the podcast and transcripts link in the menu section of the forms page also. So let's continue our discussion and building on the foundation set during the first webinar. And remember, these are the 7 points for improving patient satisfaction. I keep going back to these because Pinnacle's study found them in our top performers. When these attributes are practiced by your agency, then you will be providing the best possible service you can, which will show in your CAHPS scores. If you missed any of the previous webinars, you can watch and listen by going to Pinnacle's new support website. There you will see sections called Overview, Quick Start, Courses, and Best Practices. And a lot of these documents that will help you with training are posted there in PDF forms. And if you have any questions, feel free to reach out to me and I can direct you to those forms also. Now, I'd like to have another check-in. How are your quality improvement goals coming along? During the first webinar, I asked you to set a goal for 3 months. Now it's been 2 months. Do you have your goals written and visible to your team? Do you have specific action items for each goal? Have you celebrated successes? And what are you doing to recognize employees? We'd love to hear from you. If you have any examples of how these goals are working for you, please let us know. So on to our main topic today, Pinnacle's Comment Alerts. Let me explain what a comment alert is. A comment alert is defined by any of the following being stated during an interview by a respondent: severe dissatisfaction, reference of leaving the agency or wanting to discharge, any issues with pain at all, medication problems, not getting there on time, not knowing what to do, anything with medication, litigation or state involvement, a staff member recognized by name, or a strong request needing a visit or a phone call. Most of these are extremely negative, but along with them, you can see that there is an opportunity for positive feedback through the staff member being recognized. And we work hard to get these comments to you early so that you can take action on them. Now, this is the process. If any of these are mentioned during an interview, Our trained staff will mark the survey as a common alert. The survey still goes through the editing process to ensure accuracy. Then within 24 to 48 hours of a respondent mentioning any of these issues, the common alert gets sent to you. The interview report is uploaded to My Pinnacle, where you receive your reports, and you're also sent a notification email immediately so that you know you have an interview waiting for you. The report in My Pinnacle is called Interview with Comment Alert, and you can do a search and pull all these up. So also, so you know, there are rare circumstances when a patient needs immediate help. And for these circumstances, we will give you a call. Now this portion applies to home health. Sorry, hospice, but let's introduce some of the extra questions. So comments made by respondents, which can be the patient themselves or by a proxy, come from the 4 Pinnacle questions added to the Home Health CAHPS survey. The first question is, can you tell me what you've appreciated about home health? And note that the interviewer will say your agency's name in place of the words home health. That way, the respondent knows that they are talking about your home health and not another agency. So here are a few actual comments made by patients, and any of the names that you see have been changed for privacy. The comment here, I appreciate that they have always been there for me. I've been with them for the last several years. The staff are very polite and trustworthy. I can depend on them. The next comment, I appreciated that they were very thorough and they cared. They treated me with respect. They were in contact with me whether or not they would be running late. They followed through on the plan that we set up and coordinated with the doctor on what he wanted. If nothing else, getting these common alerts to you gives you data ahead of the monthly report so you can see how you are performing in real time. The next question asked is there a staff member that you would specifically like to recognize? This comment made during a proxy interview by a daughter about her mother's care. She said, I would like to recognize Betty. She did a real nice job. She went out of her way to make a booklet from German to English to help my mother communicate with the nurses and to help them understand what they were doing. She went above and beyond. I would like to recognize Sherry, the physical therapist. She was very thorough. I would like to recommend that they make sure they contact the guardian or the family member to discuss matters with them before talking to the doctor or putting the referral through. I wasn't involved at all and wanted to be in the loop. Now you can see Nurse Betty went above and beyond, and here's the patient tattling on her. Remember, in your My Pinnacle account where you view reports, you can also generate a certificate for this employee who is going above and beyond. We have many agencies using this feature to help recognize their staff on a day-to-day basis when they're named in a survey. Here's another comment worth noting. Again, any names mentioned have been changed for privacy. They were wonderful. They had great eye contact and didn't ramble at you. They respected the fact that you were a human being. I would like to recognize Roman. I like the way we exercised. My feet ache so bad. I have arthritis in the knee and a bone spur on my hip. Haley and Jenna helped me. I still need attention and I'm not going to get fixed overnight. In order for me to get around, I need someone to help me with exercising and things like that. I'm in pain and I don't understand why. We did not talk about the side effects. We don't know if the side effects are why I'm having trouble. I'd like it if they had more staff, but because of the health insurance, they stop at a point and say that's as far as they can take you. If I need more help after 60 days, I can call them. I don't want to call another home health outfit. I heard about them through my doctor. Now, this, again, is a real patient expressing his thoughts and concerns. And my question to you is, after hearing this, what are you going to do to encourage your staff? What action? would encourage them. The next question, what improvements would you recommend they make? I really appreciate the help. I would like to recommend that they could improve the scheduling better. They need a plan to plan the people better because they have to see a lot of doctors, and some people wait until the last minute to call me. I'm having a problem getting some appointments scheduled. So here's your chance to see and find out firsthand action steps that you can put into your quality improvement plans. Here's another comment. I would like to recommend that they need to be more human, like the therapist. The medicine caused me harm, so I stopped taking it. The nurse scolded me. I told her it was doing damage to my brain and it hurt. I don't need to become stupid in my brain. The nurse was not very friendly. Now, there's some issues that need to be resolved, maybe between the nurse and the patient. And it is up to you to decide if it is like behavior modification or training with the nurse, or if the nurse and the patient are not a good fit, then switch it up and send somebody else different that you think would do well. Again, I'm asking, what are you going to do to encourage your staff? How can their current behavior or process change to resolve patient concerns and improve your quality of care and the patient's satisfaction of care? This last question, can you tell me how you heard about home health? Again, your home health agency name is inserted there, or who specifically recommended them to you. I appreciate that they do communicate together with my doctors, especially the nurse. I'm always kept in the picture and know what's going on. We laugh together a lot. They celebrate with me when I have triumphs. I feel like they are in my corner and cheering me on, especially the physical therapist and occupational therapist. It helps motivate me a lot. I feel they are very experienced. I would like to recognize Nicole, the nurse, and Spencer, the physical therapist. My son recommended them to me. He was a nurse's aide in an assisted living place. He felt they were top in the field. When it came necessary for me to have help, he was the one that got the ball rolling. Well, this is a really great comment, and it helps you realize that your referral sources come from a lot of different places. This patient loves the care and gave valuable feedback about they heard about the home health agency. This question helps you track your referral sources and be sure to reach out and thank them when possible. Now this question is in the development phase, so please offer your feedback about it. And we've started using this question in the skilled nursing industry, and this would be the 5th question added to the home health CAHPS survey. Do you have any immediate medical concerns at this time? Now, if the response is yes, then they will be prompted to explain further what is needed. And if it shows that it truly is an immediate need, it will get pushed through as a common alert. And the intention is to help you reduce hospital readmissions by helping you find out sooner that a patient needs medical attention that you may not be aware of. For hospice, commentary is added with the Hospice CAHPS survey questions. There aren't any extra Pinnacle questions because it is a longer survey anyway of 40 questions. If the respondent volunteers extra information above what the CAHPS question is asking, then that commentary is added into the survey. These comments will still be sent to you in the comment alert format, but they are more rare due to the nature of the survey and the timeliness that we receive the information. And I hope you enjoyed listening to some of those comments. Remember, they are real people and real concerns that come up often. I see comment alerts day after day, and these issues are forefront in the home health arena. And it will take your creativeness and your intuition to keep working on them and just keep solving them for patients. Now, here's the big question. Are you listening? What do we do with the comment alerts once the report is in your system? We have built a task feature into My Pinnacle, and as upper management, you may assign a task to someone else by typing the @ symbol and their name and sending them a message of the instructions you'd like them to take. Once that message gets sent to them, that they have a message, they'll log into My Pinnacle and review the patient's comments and review your comments and what they need to do. Once they have completed the action, they can go back into My Pinnacle and mark the task as complete and add their feedback about how the situation was resolved, so you have a clear chain and out of email, keeping it safe of HIPAA information, of secure information for a patient and a situation. For more guidance on using the task feature, because it's kind of new, you can watch a video in the training section of our website. And for first-time users to My Pinnacle, the video is the first thing you'll see when you log into My Pinnacle. So again, let me stress, follow up with patient needs. In the event that a patient attaches their name following the consent to share portion of the interview, make sure to follow up with any needs that they have. Sometimes simply addressing a concern will transform a customer from satisfied to fiercely loyal. This can mean the difference between your agency being marked as a probably yes, we'll recommend, to a definitely yes, we will recommend your agency. This is key, so key for your CAHPS scores, is to perform above and beyond. Another question that we get quite often, what if the comment made by the patient doesn't relate to your agency? They hear this is a survey about healthcare, and they're thinking all healthcare. And issues will come up, especially if the patient is in a facility. The lines between who is caring for them can be blurred. First off, understand that comments are not publicly reported. They are for your benefit only. If you see the patient in a facility and the comment addresses the facility or their staff, then it may be worth letting the facility know about that concern or the praise that they received from your mutual patient. It's always, always at your discretion how to follow up with any comment alert made by a patient or their caregiver. Let's go back and reference the 7 points to patient satisfaction, the one called Making Lemonade from Lemons. I'll be honest, you will get a bad survey every once in a while. There are people out there that you just can't please, or there really is a situation that needs to be taken care of. What you decide to do with negative feedback defines who your agency truly is. Suck it up and learn from it. We all do our best, and sometimes mistakes are made. We need to learn from them and not cover it up. Sometimes expectations are not clearly defined and there are misunderstandings. The quicker you acknowledge a problem and resolve it, the less your reputation will be damaged. So this is a question I really want to know. I'm going to switch tracks here. Let's do another poll question. The question applies to home health. Sorry, hospice again. And the question is, how well do you feel prepared for PDGM? A, fully prepared. B, almost ready. C, need to work on it. D, what is PDGM? So just as a reminder, here at Pinnacle, we are aware of PDGM, but the CAHPS survey does not have any changes proposed due to this. But what I've learned from the information out there is that you will need to lean more heavily on quality improvement to succeed with PDGM. And how can you do that? We're trying to train you. We're giving you keys and information. And again, please let us know what is working for you and what isn't. And we really value your feedback. So let's see, are the poll results available yet, Kim?
Yep, they are. It looks like everyone who voted said they need to work on it.
Ooh, okay. That is pretty solid. Let's work on that. There are a lot of resources out there. Honestly, I have some in my pocket I can give you, but going to search and using all of your available resources, other vendors, your software vendor, reaching out, please. This is the time to learn and understand it now. From what I've heard, January is not the time to be learning about it. So just a fair warning on that issue that is pretty important right now. Now, I wanted to take a moment for you to meet Pinnacle. We want to be sure you think of us as part of your team, so we've created a video introducing who we are. Thank you so much for taking the time with us today. Let us know. I hope you got to get the feeling from watching that video that we're working hard for you. A lot of smiling faces. So let us know if you have any concerns or questions about the CAHPS survey. And with that, we will open the time to Kim.
Awesome. Thank you, Angel. Okay, if you have questions, this is a great time to ask them. To do so, as a reminder, open your control panel by clicking on the orange arrow that is pointing left. There is a question section where you can type your question and press send. It looks like we have our first question in. It is, when is the next hospice care refresh?
Okay, so for those hospice agencies, the next refresh will happen by the end of this month. The reporting period is a 2-year period. It is from July 2016 to June 2018. So the old quarter will drop off and the new reporting period coming up will be quarter 4, October 2016 through quarter 3, September 2018. And since we're talking about Hospice Compare, I'm going to throw in Home Health Compare too. This was just refreshed in July, so the new information showing is for the reporting period January 2018 to December 2018. It's just a 1-year reporting period and it's available now. Home Health is always refreshed first, then the following month Hospice comes. And then they have a month's break. Are there any other questions?
Yeah, there's another one in here. It says, I'm with a home health agency. Can we put a different phone number if a patient is not able to physically or mentally answer the survey?
Oh, yes. You may put a telephone number for a proxy, which is really the best thing to do. With the telephone survey, we need to be sure that we can reach somebody that knows about the care, and it can be a family member who is familiar with the patient's care. Be sure to use the Pinnacle survey memo to let them know Pinnacle will be calling so they can answer the phone and understand who it is that's calling.
Okay, it looks like those are all of our questions. If you have a question that you didn't get to ask, you're welcome to email Angell, and her email address is Angell, Angell .Hanson, HANSON @pinnacleqi.com, and she will get back with you on that. Thank you so much for attending the Pinnacle CAHPS Q&A session, Lunch with Angell. As I mentioned earlier, we will email you the recording of the webinar and a link to the slide deck. So keep an eye out for that in your email inbox. And thank you, Angell, for this Q&A session. We look forward to another Q&A session on the first Wednesday of next month. Until then, have a great rest of your month.